My name is Nabiha Islam, and today I'll be presenting our project, The Prevalence of Academic Dermatology Clinics Providing Language Concordant Care to Spanish-Speaking Patients. I'd like to thank my research mentor, Dr. Jessica Kaffenberger, as well as the Division of Dermatology at The Ohio State University for their support and guidance throughout this project. U.S. Census data reports that there are currently over 16 million Spanish speakers living in the United States with limited English proficiency. Previous studies have shown that Hispanic patients are less likely to utilize outpatient dermatology services compared to Caucasian patients, and that significant burdens of skin disease exist in this population, including reduced rates of 5-year melanoma survival. Language barriers may contribute to these disparities. There is little information documenting the availability of language concordant care for Spanish-speaking patients in dermatology. Our primary objective in this project was to characterize the prevalence of academic dermatology clinics providing language concordant care to Spanish-speaking patients. We administered a phone survey to all ACGME-accredited academic dermatology programs evaluating their primary adult general dermatology clinic. We made inquiries regarding program size, Spanish-speaking physicians, interpretation services, Spanish language resources, and informed consent forms. For the purposes of our study, Spanish-speaking physicians were defined as physicians who speak Spanish as well as conduct dermatology clinic in Spanish. We also asked programs to estimate the proportion of Spanish-speaking patients requiring interpretation at their clinic. We contacted 142 programs and collected responses from 104. In Table 1, we present the regional distribution of programs included in our study and find that we had a fairly even distribution of programs located in the central, north, south, and western regions of the United States. Respondents to our phone survey included clinic coordinators, office staff, nurses, and medical assistants. When asking programs to estimate the proportion of patients requiring Spanish interpretation at their clinic, we found that 49% of programs report that more than 10% of their patients require Spanish interpretation. In Table 2, we present the availability of Spanish language resources by program. As part of our study, we included an evaluation of the automated scheduling menus of each dermatology program and found that only 26% of programs included a Spanish language automated menu option. No program in our study reported a fully Spanish language dermatology clinic. However, 53% offered in-person interpreters and 72% reported having patient education resources in Spanish. These education resources were institution-specific Spanish language handouts related to skin disease and skincare, as well as EMR-generated translations of after-visit summaries and patient instructions. 75% of programs reported having Spanish language informed consent documents, and 42% of programs reported having at least one Spanish-speaking dermatologist. In Figure 1, we present the average estimates of limited English proficiency Spanish-speaking patients in general dermatology patient populations by state, and find that a higher proportion of these patients were in the southern and western United States, as well as in places like Illinois and New York. In Figure 2, we present the distribution of programs with at least one Spanish-speaking dermatologist, and find that this reflects the distribution of the Spanish-speaking patient population, again with concentrations in the southern and western United States. With only 1 in 4 programs offering Spanish language menu options, a lack of language inclusivity in the scheduling process limits the autonomy of Spanish-speaking patients in seeking dermatology care. 47% of programs do not utilize live interpreters, which has been associated with increased clinic efficiency as well as improved patient satisfaction. At 57% of programs, patients will have a language discordant physician, which may influence care outcomes, discussion of sensitive issues, and overall patient satisfaction. Limitations in this study include that we evaluated a single center per program, that informal Spanish language clinics may not have been known or reported by respondents, and that we were dependent upon a single respondent per center. In conclusion, 49% of academic dermatology clinics report that greater than 10% of their patient population require Spanish interpretation. This reflects a need for increased language-inclusive care, especially in telephonic scheduling services, access to live interpretation, and access to Spanish-speaking physicians in academic dermatology. Thank you so much for your time, and I hope you enjoyed.